Good morning everybody. OSCE with Bimel എന്ന എൻ്റെ ചാനലിലേക്ക് സ്വാഗതം. ഇന്നത്തെ ടോപ്പിക് ഓഫ് ഡിസ്കഷൻ ഈസ് നമ്മുടെ ഓസ്ട്രേലിയൻ ഓസ്കിക്കകത്തുള്ള പെയിൻ അസസ്മെൻറ്റ് സ്റ്റേഷൻ പ്ലസ് പെയിൻ നോൺ ഫാർമക്കോളജിക്കൽ പെയിൻ മാനേജ്മെൻറ്റ് ഈ രണ്ട് സ്റ്റേഷൻസും ക്ലബ് ചെയ്തിട്ടാണ് വരുന്നത്. ഈ ടാസ്ക് നമ്മൾ എങ്ങനെയാണ് പെയിൻ അസസ്മെൻറ്റ് സ്റ്റേഷനിൽ ഫിനിഷ് ചെയ്യുന്നത് നമുക്ക് നോക്കാം. സോ once as usual you will be getting 2 minutes reading time. Once you reach over there in the corridor there is a tablet will be given for you, so you have to look for the scenario will be there. The scenario will be quite similar to a storyboard. So a patient is having some problems. So as example, patient had a fall from a bicycle, or patient was going for a trekking and he had some fall or some stuff like that. So usually what's going to happen is your patient is presenting with some kind of orthopedic pain, some sprain or some edema or somewhere in the upper arm or lower leg. That's usually happening. These are the scenarios usually the students are going to get from my experience. Okay. The next one is once you finished your reading time, you have 2 minutes reading time. You finish your reading time. Then the second bell is going to ring. Then straight away you have to enter the station. As usual with any other station, you have to knock then to enter the station. Then you have to do the standard operating procedure, something like you have to look for scene safety, that's important, and safety is deliberately breached, you have to manage it. Then the next one is you have to do provide privacy and dignity. The next one is you have to look for the 7 steps of hand hygiene, that you have to do that. Thereafter what you are going to do is you have to go for introducing yourself. The next step is you have to go for you have to ask for patient's name and patient date of birth, confirm with the patient's ID band. So you have to use either patient file or a patient's contacts will be given to you to confirm with the patient's ID band. That's okay, that's there. Now the trickiest part. After this one, where you confirm the patient, you have 2 options will be there. So the additional task will be there. You have every station you have to look for allergy status. If there is an allergy is there, you have to manage that. Okay. Next one is you have to look for pain. Here patient, you are aware that patient is having pain, so don't ask that question, do you have any pain? No, but you have to talk to the patient. It looks like you had a fall and or you had some sprain or something, so you are in pain. That's why I understand. So my task is I'm here to assess your pain and do some management strategy over there. That's why my purpose of visit. So this you have to talk to the patient and you have to convince or you have to get a consent from the patient. Thereafter you can assess the patient's pain. So I am here to do the assessment with the pain, and thereafter I will decide a plan of action straight after that. So this is what you are going to do. So usually once you reach over here, then what you have to do is you have to assess the patient's pain with a PQRST method. Okay, so in Irish scenario they are using for OPQRST method, and the UK scenario is PQRST method, and the Australian scenario is PQRST method, but there is O inside as well. We will see what's going to happen at this stage. So PQRST means the P is for provocation or palliation. So patient himself will be doing some what is the reason for provocation, so how this pain has started, so what was the beginning of there, and did you do anything for yourself to manage pain by pain to reduce the pain. So that's called a palliation. It's not the conventional palliation towards the end of life, it's the palliation that you are going to reduce the pain over there. Okay, thereafter you have to look for quality and quantity there. Okay, so you have to look for what's the quality of pain and you have to ask for quantity of pain, so the amount of pain you have, how bad it is, how much how worse it is, that type of questions you can ask. Next you have to look for region and radiation. Where the pain is there and where is the radiation start, is it going somewhere else? Okay, the next one is you have to look for a severity scale, in which you have to assess the patient's pain status with a severity scale. Thereafter you have to look for the timing. So what time the patient what is the onset of pain status and how far it is going, it's moving, is it staying there, it's going around, or this type of questions you can ask over there. And thereafter you have to look for once you have assessed the pain status, okay, the PQRST assessment is done, then you decide upon what is the management strategy you are looking for the patient. Ask the patient, are you looking for any medicine? Usually patient will not be looking for any medicine, and patient is then ask the patient, what else I can do for you, how can I help you? So patient will be usually looking for some alternative measures. So you have to give some alternative measures for the patient. So for example, you have to lift the head end of the patient, or you can give an extra pillow for the patient. You can apply some crepe bandage over there. You can give some hot water application or cold application or some stuff stuff like that. These all things you can do at this stage. Thereafter, you can have a repositioning the patient, a massage, you can walk around the patient, watching telly, you can be there, reading newspaper, phone to families, all these alternative options you can talk to the patient. And some patients will settle at this stage, and thereafter once the patient has settled, then you have to document everything. But there is sometimes there is no documentation sheet is available over there. In that case, what your job is, you have to simply prompt, I'm going to document everything with the date, time and signature. That's enough. Then thereafter you have to give the call bell, and then open the curtains, and once that is done, you can come out. So that's the way you are going to finish the station. It needs a lot of communication support. So how you are going to talk to the patient, what sentence you have to make, and what are the questions you have to use to assess each and every aspect. So that needs a bit training. If you are interested for OSCE training at any point of time, come back to us, because we have extensive training programs for OSCE that's happening every month. We have OSCE for Australia, OSCE for UK, and OSCE for that's the Ireland aptitude. That is another name is Ireland aptitude training. Every week we are conducting it. So the programs will start from Monday onwards, and it will finish by Friday evening. Okay, and then they have extended programs available. For example, the student is looking for some refinement of the skills that can be done on another next week for 2 or 3 days. That's optional if they are looking for, but we will finish the station by that time. It's a face-to-face program. We have extensive experience in conducting OSCE for so many years. The way through which we are doing stations or we are doing the basic care is quite different from the Australian perspective or UK perspective or Irish perspective. There is a lot of talking is going to take place. That's called communications. Around 60 to 70% is talking. So how you have to communicate, then what are the sentences you have to make, what are the points you have to keep in mind, then patient choice, patient participation, active listening, compassion, then these are some then consent. So many points you have to keep in mind when you are going to discuss with OSCE, when you are going to approach for the OSCE over there. So we have an extensive program. We will be giving continuous language support, and we will be giving the support for students to pass over there. And once you finished your OSCE training over here, we will not stop you. We will be behind you until you get passed in your real examination. We will give you continuous WhatsApp support. If you need anything, you can come back to us, and we are here to support you at any point of time. The charts will be explained and everything explained from time to time. Those who are interested for OSCE training, please come back to us, and I will be attaching our contact details so that you can contact us. ഇത്രയും നേരം നിങ്ങൾ ഈ വീഡിയോ കേട്ടിരുന്ന നിങ്ങൾക്ക് ഏവർക്കും താങ്ക് യു വെരി മച്ച്. അതുപോലെ തന്നെ നിങ്ങൾക്ക് ഈ വീഡിയോ ഇഷ്ടമാണെങ്കിൽ നിങ്ങൾ ഈ വീഡിയോ ലൈക്ക് ചെയ്യുക, ഷെയർ ചെയ്യുക, അതുപോലെ തന്നെ ബെൽ ബട്ടൺ അമർത്തുക. എവറി ഡേ വി ആർ ഗോയിങ് ടു അഡ്രസ് വിത്ത് എ ന്യൂ വീഡിയോ വിൽ ബി കമ്മിങ് ഇൻ എവറി ഡേ. സോ അതുപോലെ തന്നെ സബ്സ്ക്രൈബ് ചെയ്യുക, സോ ദാറ്റ് യു ക്യാൻ ഷെയർ ദിസ് ഇൻഫർമേഷൻ ഫോർ യുവർ സെൽഫ് ആൻഡ് ഫോർ യുവർ ഫ്രണ്ട്സ്. സോ താങ്ക് യു വെരി മച്ച് ഫോർ listening our video, and I will come back with another video on tomorrow. So thank you.